The federal government has made its healthcare pitch to provinces and territories. A 10-year, $196 billion plan, but only $46 billion of that is new money. And that's a fraction of what the premiers called for. So will they accept it or dig in their heels for more cash? Andrew Furey is the Premier of Newfoundland and Labrador, and Dennis King is the Premier of Prince Edward Island. They're both here. Gentlemen, thanks so much for coming in.
Thanks for having us, David.
I want to start with the deal, the proposal, the plan, whatever you call it, from what the Prime Minister put on the table yesterday. Premier King, let's start with you. Some of your colleagues said, oh, there's room for negotiation. This is a starting point. Do you think there's room for negotiation, or this is it?
Look, I would call it a really important amount of money for P.E.I. Will it ever be enough money? Probably not. Will we continue to want to ask the federal government for more money? Yes. But overall, on the surface, the way we were able to negotiate some of the bilateral arrangements that we have, that P.E.I. stands to bring in about $400 million of new money over the next 10 years, and that's money that's needed in the system. So that's my job, to take that money and put it to good use and to make healthcare a little better for P.E.I.
Yeah, well, you wouldn't be premiers if you weren't asking for more money. That's just the way it goes. But Premier Furey, what's your sense of it? Like, do you think this is it? This is the federal offer, this is the federal plan, and money and length is not up for discussion?
I think they've made that maybe not perfectly clear, but certainly it's been the suggestion. And I think the Premier and I see a couple of real wins in this, David. So the thing that I'm most excited about, it's not the most sexiest to talk about on TV, but is the change in the formula, perhaps. For us as smaller provinces, there's a big give by the federal government here, recognizing that smaller jurisdictions have unique, well, not unique because there's a bunch of us, challenges that other bigger jurisdictions don't have. And so the previous formula of a straight per capita is actually punitive to some of the smaller jurisdictions. That's a big concession by the federal government to look at changing the formula for CHT. So for us, that means that it's a recognition for things like demographic challenges, geographic challenges, and medical complexities that are incumbent and inherent, on an older population. So that's a big win. It's not one that will definitely make the headlines because the quantum is what everybody is interested in. But that is, and it was a source of incredible discussion, and I think it's a big give by the federal government and a big win for places like P.E.I. and Newfoundland and Labrador, Manitoba even.
Right, so you have those changes there, and you also have the bilateral agreements, Premier King, which you talked about. I mean, there's been a lot of discussion, some premiers saying, well, we need to look at this and absorb this and figure out whether we're going to accept this. I mean, what's your sense? The federal government wants the bilateral agreements done within weeks. Do you think P.E.I. can get to a position where you can sign this within a matter of weeks?
Yeah, again, as I say, this is money that's so needed in P.E.I., and we need to get to work on it as quickly as possible. I've never looked at this as just the only deal that we will have or the only arrangement that we will have. Our job as Premier is to lobby the federal government to get more as much as we can. So I'll always try to do that. But I don't think as Premier of Prince Edward Island, I would be in the position to say, I don't want this money from the federal government. I want it. Could I use more? Absolutely. Will we continue to try to lobby for more? Yes, but I think we're ready to sit down and start to talk about what we can do in the bilateral process and how quickly we can get to work. And as I say, trying to achieve a better level of health care across the board for Islanders.
So it's a matter of when, not if, for P.E.I. in terms of signing this. Same with you, Premier Furey. Are you going to get this done by the federal budget, do you think?
Absolutely. I think I can, and I think we will. I think if you look at the priorities, the shared priorities, perhaps, that they articulated within the bilateral agreements. These are things that Newfoundland and Labrador has already been proposing. So things like advancement in our health information system. That is something that is much needed for Newfoundlanders and Labradorians and arguably Canadians from coast to coast to coast. That's something that we have already thought about. We've already put a policy behind, and so we'd be ready to start those negotiations fairly quickly. That said, I do respect the collective will of the council table to take individual time to have an analysis for each jurisdiction, recognizing that not everybody is on that same page, but we're having a meeting on Friday, and I'd like to move quickly.
Okay, so that's where I wanted to go next. You're going to meet on Friday as a council, have a conversation about this. So where does this go? If you guys are ready to sign on to the bilaterals, we heard Premier Legault say this isn't enough money. Doug Ford called it a down payment and a starting point. Premier Eby said it's fiscally limited. Heather Stephenson said there's not enough cash here. So where does this conversation go? First Premier King, then Premier Furey. If you guys are okay, and you're getting close to sign, and others.
Well, there's a nuance in it's just the premise
Go
of the
ahead.
question is, you know, we never said we're perfectly okay, and I don't think anyone at the table is perfectly
Fair.
okay.
Yeah.
So that premise is perhaps a little bit off. But you go ahead, Dennis.
Yeah, I just think that, you know, again, the discussions have been what they've been. Premiers have put forth a number which we felt would bring the federal government up to a level of spending at 35%, which would be more consistent with what we need. I don't know if we've given up that ghost, so to speak, but I think what we need to do now is sit down and say, how does this impact the people of Prince Edward Island? How does it impact the people of Newfoundland and Labrador? Let's get to work. And I think Islanders, I can speak for Islanders, and I feel for Canadians at least, that they're a little bit tired of tax points. They're a little bit tired of percentages. What they really want is a better delivery system for healthcare services across the board. That's what I'm trying to do. This money will help in that, but you know, it's a long road for all of us, but the money will help. And I'd rather get to work on that as opposed to trying to go back and forth all the time with the federal government. We need more.
Oh, just go ahead.
Yeah, I think I do think there's a collaborative path forward. I think the political rhetoric and perhaps the expectations were raised to a temperature that was perhaps unnecessary at times. Right. But I do think Canadians expect and demand that we work collaboratively, because you've heard me say before, David, that I've seen it. I've been on the other side of a gurney delivering bad news, delivering a consent for an operation. Not once has someone asked me, who's paying for this? The federal government or the provincial government? Canadians expect us to work together collaboratively to enhance their medical services, and I don't think there has to be an adversarial relationship. There shouldn't be an adversarial relationship. There should be a collaborative one. And while we can agree that we won't always agree on everything, I think the time has come for us to be looking forward together.
So one thing you both agreed on in your comments yesterday is the need for innovation and change in the system. You both referenced it specifically. There's no giant pool of unemployed nurses and doctors out there that you can hire. That would have been done if that was it. Well, no, but you know that would have been done if it was the case. But you know, Premier Fury, you said yesterday that it's a system stuck in the 1960s. What do you need to do to bring it up to the 2020s and to get it ready for the 2030s?
Absolutely. So for Newfoundland and Labrador, for example, and I would argue that we're just an example for the rest of the country, but perhaps an extreme. You know, our system, when we signed on for universal health care, is based in the 1960s. There was 6 children for every senior in Newfoundland and Labrador in the 1960s. Today, there's 2 seniors for every child. Mm-hmm. I mean, you think about the calculus of that, the system has to change, it has to shift.
But how?
So this is how. So we have put together an all-stakeholder plan called the Health Accord NL, where we, even despite the challenges of the pandemic, I knew, coming from the hospital myself, that the system was on the verge of collapse. So we engaged all stakeholders, all of different political stripes too, to come to the table with solutions. So we set out a health accord that addresses modernizing the system towards a sustainable solution that Canadians can once again be proud of, certainly in Newfoundland and Labrador. That involves investment, by the way, David, in the social determinants of health, something that we've neglected collectively as a country to really talk about, but is the primary driver of health outcomes. We've also want to ensure that we're using the investments wisely to upgrade our health infrastructure, the system infrastructure, modernizing the medical records, look at eliminating red tape for the practice of medicine and mobility across jurisdictions and between countries. These are kind of the creative solutions that we're putting in place with the foundations largely shared and aligned with what the federal government set out in its shared priorities yesterday.
So Premier King, with you, what does innovation look like in P.E.I.?
Well, for P.E.I. and following the lead of my colleague from Newfoundland and Labrador, we brought together the heads of all of our professions and sat around the table for a number of hours and said we have to stop looking for this magical pot of nurses or doctors that does not exist, and how can we work within the existing system to deliver on a better system. So where we have landed is on our collaborative model of care, which we call patient medical homes and neighborhoods in P.E.I., where we will bring a family doctor or 2 or 3 that will work with a nurse practitioner, an RN, an RCW, a social worker within one.
Registered care workers,
all of those people. And so to make it, when you walk in as the patient in Prince Edward Island, there is a level of service for you there based on what your need is. And we'll have 14 of those patient medical homes set up by the end of March. Mm-hmm. We're also doing what we call Pharmacy Plus, where we've given our pharmacists the opportunity to treat 32 common ailments ailments that normally you would need to go to the ER for or to a walk-in clinic. So we've made some of those innovations. We have to continue down that path. And where we need the money is to, if we're going to continue to ask people within the system to do more, to change what they do, that's going to take money. If we're going to meet the long-term care requirements, the national standards that we're talking about, that's going to take a significant investment, and that's where this money for the federal government will help us.
Just one last point, because I'm out of time. Do you think this ends the fighting over money, at least in the short term, and the focus is on...
You're asking if federal-provincial relations will never talk about money ever again?
But does this put the focus now on the solutions, on the changes, and away from trying to get a meeting and trying to get more cash?
Well, I think it was an important gesture to have the meeting. It's one that we've been asking for 2 years. I do think that we have been, I certainly have, and Dennis and I have been united in the fact that cash alone will not fix this, and we've kind of addressed that here today. I do think that Canadians expect and demand us to look forward to solutions to recreate a healthcare system that they can be proud of once again. And right now, Canadians aren't. But I think we all believe, we're all at this table because we believe it can be again in the future.
And in the early 2000s, I was a staffer for Premier Pat Binns when he sat at the table arguing the very same thing that we're arguing about, that the federal government needs to spend more money in healthcare to the provinces, and they were mildly successful then. I think we were mildly successful now, but I don't think that...
You're dating yourself now, Dennis. I thought you were younger than I was.
That never ends that battle.
Mildly successful, the Canadian outcome. All right, Premier King, Premier Fury, thanks so much for coming in.
Thanks, David.
Okay, so could the NDP break its confidence and supply agreement with the Liberals over healthcare? NDP Leader Jagmeet Singh joins me now. Mr. Singh, you heard Mr. Blanchette there. He dared you and double dared you to vote against this upcoming budget because it's a failure on healthcare. What are you going to do?
Well, we're not going to make a decision on a budget that we haven't seen yet, but what we are going to do is continue to raise the concern that on one hand, we've got Prime Minister Trudeau back in the last election say that for-profit private care was wrong, is a bad thing to do, warned people against Aaron O'Toole, the previous Conservative leader, saying that's not something that we should be doing, and now is calling the very same thing, private for-profit care, innovative. And we said, well, this is the opportunity to show if you're going to stand up for public health care, you're going to support the hiring of more healthcare workers to solve the crisis so that people can actually find a family doctor and not have to wait for hours and hours in the emergency rooms. And he chose to stand down and not actually defend our public healthcare system.
So you call this deal a failure. You call, essentially, that would mean the Prime Minister is a failure on this. Is that a fair characterization of your opinion on this?
What we said is that the way we're going to judge this deal is whether or not it actually has clear elements, something concrete to hire more healthcare workers, given that the crisis in our healthcare system is a shortage of healthcare workers. And so far, there is no concrete measure in this agreement or this offer to the premiers that's going to actually hire more healthcare workers.
Well, you keep coming back to private for-profit care. Family doctors are private for-profit care. They're private companies. They're paid out of the public money, but they make a profit. So what's wrong with the expansion of a model of something like what we see with private doctor clinics? Well,
there's a major difference when we're up against a shortage of healthcare workers. And the solution to the problem is to hire more healthcare workers. What Doug Ford, for example, in his for-profit private delivery model is he's going to put more money into for-profit, and what that's going to do is make the emergency room wait times even worse, the overcapacity in the children's hospitals even worse, because where are those workers going to come from? They're going to fill this massive expansion of the for-profit sector.
But that's a separate issue from the model, right? Like the cannibalization of human resources, an enormous challenge in the health system right now. But you have a family doctor, I'm assuming, right? You go to your family doctor, I go to mine. It is a private clinic that is a for-profit center. What is wrong with the expansion of that model if it improves access and outcomes for patients and they don't have to pay out of pocket?
It won't actually improve the access, because the issue is we've got a healthcare worker shortage. And the only way we can fix that is by hiring more healthcare workers, retain the workers we have, recruit and train more workers. And if we're not doing that, we're actually going to make the situation worse. And we've got many experts who've said, the Ontario Nurses Association, the College of Physicians and Surgeons for Ontario, have all come out saying really clearly, this approach is going to make things worse because it's not going to hire more healthcare workers. The problem we're up against is a shortage. And instead of hiring more workers, you're going to put more money into a for-profit system, which is going to cannibalize and poach those workers that are in the emergency rooms. It's not going to solve the problems. We've got a public system that works. Let's invest more in the public system.
But that I guess, wouldn't solve the problem if you look at healthcare primarily as delivered through hospitals. But like primary care, I mean, the big barrier is about 6.5 million Canadians don't have a doctor, don't have a nurse practitioner, don't have that primary level of care. So some of that is just a human resources training thing. And this is on the provinces to do. do, right? This is the Premier's job. So when you're criticizing the federal plan, isn't it really the Premier's you need to see the plan from? Because provincially, that's where the licensing comes from, and that's where the hiring happens.
Well, the Prime Minister himself made the promise in 2021. He promised to hire 7,500 more nurses and doctors. That's the Prime Minister's own promise. We're saying, yeah, we need more nurses and doctors. He promised to do that. Why would he make that promise if he couldn't fulfill it? Why would he say to Canadians come election time in 2021 that that's what he's going to do if he couldn't do it? We're saying, yeah, of course you should do that. As the leader of this country, as the Prime Minister, make the investments, negotiate with provinces, deliver the funding to hire more workers. And there's a big difference between a for-profit clinic or a fee-for-service physician. That is a very different scenario. What Doug Ford and Daniel Smith are proposing are for-profit clinics where they're going to have a buffer of profit worked in, not fee-for-service. They're going to cannibalize the public system, make things worse. That's something that we're opposed to.
But if they can set up a private clinic to do cataracts, hip surgeries, knee surgeries, the sort of things Premier Ford is talking about, and they can do that and find efficiencies in their operations without charging the taxpayers more and without allowing queue jumping and charging individuals, and why should that matter to patients?
Well, it's not about the patient experience. Well, it is about the patient experience. I'll get to that. It's about the problem that we're up against. The problem is one thing, shortage of healthcare workers. The solution has to be finding a way to get more healthcare workers into the system. The solution that's being proposed by the for-profit privatized scheme is not going to increase more workers. It's going to pull workers from somewhere. If we've got a shortage and the solution is to do more for-profit work, you're just going to pull away from the public system that's already been underfunded and under-resourced, pull those workers out of that, because where are those nurses, where are those healthcare workers going to come from? If we've got a shortage, they've got to come from somewhere. There's no plan to recruit and train more. It's just to pull them out of one system.
The bilateral
into
agreements have money explicitly for provincial governments and territorial governments to come up with a plan to hire professionals, to work on primary care, to work on backlog. That's where the plan is. There's $25 billion there, and the focus there is on primary care. That's the hiring plan, is it not? It's up to the various premiers to figure out how that works in their jurisdiction.
Well, the Prime Minister had an opportunity to make it clear that all of our public dollar at the federal level, all of our public money should go towards hiring more healthcare workers. He made it clear, well, Doug Ford made it clear when asked the question, was there any discussion about privatization or for-profit care? He said, no, that did not come up in the
conversation. But they talked about compliance with the Canada Health Act, which does allow for private delivery as long as it's done through...
But in this current crisis, where we've got a shortage of healthcare workers, it is irresponsible for the Prime Minister, when negotiating with premiers, to say it is okay for you, or to not even raise the question of the for-profit delivery, when the healthcare professionals that deliver that care are saying, that is not going to make things better. In fact, it's going to make things worse. For the Prime Minister of this country, who said, be worried about the previous Conservative leader because for-profit care is dangerous, 2 years later to say nothing about it when negotiating with premiers is irresponsible. It's a major flip-flop on the part of the Prime Minister, and it shows that he's not committed to public care, and he's also not committed to solving the problem.
So let's come back to where this started. If you would never support Aaron O'Toole in a minority parliament because of his position on healthcare, if there is no daylight between Justin Trudeau and Aaron O'Toole now, based on the way you've characterized his position, and this is such a failure, why do you feel the need to keep supporting them? If it's that bad, why do you keep propping them up?
Well, first of all, we're not making that decision today, but we are making it really clear that we have a massive disagreement. The position that Prime Minister Trudeau is taking today, or has been taking over these past couple of weeks, is a stark difference from his previous position where he said that for-profit delivery was wrong, and now he's saying it is innovative. So it is a massive departure. And yes, we fundamentally disagree with the Prime Minister and with the Conservatives. It seems like, based on the words of the Prime Minister, that he is in favor of for-profit delivery, which is much like the Conservatives. I'm not surprised about them. I am surprised that the Prime Minister is taking this approach, and I frankly think he's wrong.
Okay. Jagmeet Singh, thanks for coming in. Appreciate it.
Thanks.
It's NDP Leader Jagmeet Singh.